15 and they're about to begin their race. We're going to introduce each one. I'm Victoria. What grade are you? 10.
I'm Guan, I'm a senior.
I'm Melody and I'm a senior.
I'm Didi and I'm a senior.
I'm Bob and I'm a senior. I'm Sophie and I'm a senior. Awesome, let's race.
Our main idea consists of 3 different parts. The first of which will be informing people of the community and the residents of Miami about the lack of accessibility to healthcare that minors have in the Florida community. The second step will be hosting debates through SFL Dems in which we will invite these candidates and already elected officials to speak of how they feel we can most adequately tackle the situation of lack of accessibility to healthcare. The third and final phase will be helping these elected officials or these candidates who will be running for election take a more active interest in our situation and help us take our issue all the way to Tallahassee. Now let's take it back to the track to see how the rest of the team is doing.
The second baton pass was made when we decided to target the Florida policymakers and representatives that were willing to help us. With their help, we can start spreading our information to more members of the community at a larger scale.
We began to pass on the baton to students, faculty, and staff of ILS in order to spread the word about our debate.
Oh my God, EJ, come to our CBL debate this weekend.
All right, sounds good. I'll see you there.
All right, bye.
Hey, Donna, why don't you come to our debate this weekend? Okay, yeah, sounds good. See you there.
On December 12, 2012, we held our first debate in Tony's dad's clinic. We had a huge turnout.
Our first SFL Dems debate took place on the 28th of November of 2012. Our guests, which were kind enough to join us and agreed to be questioned in an unscripted manner, included Alex Dominguez, a candidate for District 3 of City of Miami, Adam Kravitz, candidate for State House of District 112, Gustavo Morain, candidate for U.S. Congress District 26, and Bruno Moore, candidate for State Senate. We discussed education, poverty, and most essentially, our group's main focus, lack of accessibility to healthcare among younger adults. Although the guests and the event planning consumed much of our time and many of our efforts, it was a complete reward to see SFL Dems grow the debate attendance by over 100%. Attendees like Joan Dengler, a public school teacher, remarked that these debates can help educate voters come election time, and students even before they register to vote. Candidate Dominguez himself summarized it in these words: SFL Dems is filling a void in the South Florida community. In my race there were no debates. People voted on race, ethnicity, or who looked better. With these debates, I feel more confident that the elected official will be the right official. With those words, we wish to continue our mission, and we only hope to educate the interest articulation of the City of Miami further as we go.
Influence is concerned. And I think everybody needs to say something. I think you need to make your voices heard about this.
All 3 candidates have agreed that Obamacare should be in place in Florida, but Mr. Dominguez brought up preventative care, and Mr. Kravitz and Mr. Bruno kind of followed. Why do you think children lack health care if preventative care is most important at that age?
Solution, which is a complete, rethinking of every level of health care in this country, from how we train doctors. I mean, again, you can't take. In this country, doctors come out of medical school $300,000 in debt, so that is, they can't afford to work for, they're chasing the big bucks, they're not going into family practices. And I think that, this ties into so many areas of our economy that it is just a huge drag on the United States competitively and everything else. If Mr. Moore wants to answer.
Yeah, I think the issue is kind of three-pronged. I think the affordability of wellness checkups, that sort of thing, has to come into play. But I also think, especially in at certain income levels, there's an absence of information as to why they should bring their kids, and just navigating the healthcare system is a debacle. It's like Greek sometimes.
Shout out from our sponsors.
Thank you. We wanted to ask you a few questions about group number 115. Of course. What do you think about their project on healthcare?
I think that it was quite an endeavor for them. They worked very well together. And I think that children need our attention today more than anything else. And I heard that the debates were really, really well organized and well attended. And most of our students were congratulated by prominent people in the community. So I'm very proud of them.
So as a sponsor, you feel very
that
good.
they did their job, yes. Completely. Thank you.
Thank you.
Our project revolves around the fundamental themes of Catholic social teachings, specifically helping the poor and vulnerable. As Christians, it is our duty to put the needs of the less fortunate before ourselves. The steps we have taken thus far have greatly increased our Salesian spirit in many ways. Don Bosco was a magnificent individual who was devoted to the children of God. Through his president, we are encouraged to continue his program and dedicate ourselves as Salesian to the cause of the children.
Our job doesn't stop there. We then proceeded to speak with candidates who were most supportive of the AFHCA's and other legislations to enable our goal of child health care for all. Additionally, we even tried to find out what the commissioners, representatives, parents, and students of the ILS community were planning on doing after they have heard and participated in our event.
Good afternoon. Here we are today with some members of group number 115, and they're going to speak to us about their canvassing for Katie Pierre. Tony and Cado, along with other LaSalle students, traveled to the North Miami community and spoke with local residents about candidate Katie Pierre and what she plans on doing for the community. Now, Cado, what can you tell us about this experience?
Well, we were actually shocked to see the lack of knowledge that the residents had about Katie Pierre. When asked about her, most of the residents had no idea who she was, so it was pretty shocking to see that they didn't know who was running for office in their community.
And Tony, how did you feel about this experience? What would you tell the citizens of Miami?
I felt the same way as Cado. It was a shock to see that the people didn't know the issues that are affecting their community as a whole, and I think they really need to learn about the interest articulation and everything that goes on in their community, because if they don't know the candidate, they don't know who to select to serve them best in any of their wards.
Katie Pierre is only one of the many people that are helping spread awareness throughout Florida. And I'm back to the field to see how the rest of the group is doing.
According to a study from Harvard Medical School, nearly 45,000 annual deaths are associated with the lack of health insurance.
I had no idea. Did you know that according to the Center for Disease Control, in 2009, 46.3 million people had no health care?
Wow.
And 6 million children under the age of 16 had no health care in 2009?
That's incredible.
Making videos like this will show people how we have managed to spread the word, and will eventually keep passing the baton to others who hear our story.
In my head, this is where we all came from, the dreams we have.
Well, ladies and gentlemen, this team has really gone above and beyond to help their community. Their team manager, Tony, has even been invited to be a policy advisor in the administration where he could help move their goal forward. Even further, there you have it. Florida residents will soon be thankful for the hard work their team has put into this issue. This has been an LTV Special Edition. See you next time.